Why do we need CARSS? Well, we need CARSS to try and improve the quality of patient care. The current context is that the literature suggests that about 3 to 5% of deaths have a component of avoidability that's scored at more than 50% avoidable in terms of likelihood of avoidability. So that's data produced by Structured Case Note Review. Now, if we take a hospital like ours, then last year we had about 1,200 deaths. So if we take 3 to 5% of deaths, that will take us down to about 60 to 80 deaths that may have a component of avoidability. And again, the literature suggests that about a third of those will have something, the avoidability relates to poor clinical monitoring or identification of deteriorating patients. So if we can improve situational awareness and recognition of patients who are deteriorating, then we may be able to make some impact on that number of deaths per year. Now, that number is a very important number if it's you. It's still a relatively small proportion of the deaths that happen in the hospital. So let's talk about the remaining of the 1,200 deaths. And actually, recognition of approaching end of life provides an opportunity for better communication with patients and their families, and for them to be able to have more choice about meeting their end. So it's about recognition and better quality of care towards the end of life. Does the patient get a choice about where they're going to be? Does the patient get a choice about whether they're having interventional invasive tests done, or whether actually care is switched to palliative at an early step? So it's about involving patients and their relatives in choices about their care towards end of life. Now, in addition to that, there are, of course, many more patients who deteriorate who don't eventually die, because we've managed to salvage the situation, intervene, find the diagnosis, and treat them in order to get them better. So our critical care outreach team get about 2,500 to 3,000 new referrals per year. Well, that was the data from last year anyway. And actually, if we could give an improved warning of those patients' deterioration earlier, then we may be able to intervene earlier. So that would reduce the risk of patients deteriorating to the point of cardiac arrest or death, or admission to intensive care. Admission to intensive care. But it could also perhaps reduce the severity of their illness if we intervene earlier, reduce their comorbidity from that illness, reduce length of stay, reduce cost of that stay. That's why we need CARSS.